Well, hello everyone. This is Dr. Isabelle Amigues, your friendly rheumatologist. Today, I wanted to talk with you about some help about how to choose your plan, because it's a question that many of my patients have asked. So hopefully this is going to stay on and we can share this. The number one thing is to realize that I am not a broker. I'm not a healthcare broker. I think that's how it's called. And all of the things that I'm going to share with you, you can imagine that I'm just a friend that knows a little bit, but I definitely want to share as the physician that's interested, that's coming from France, that's learning about a different plan. I have to buy my own plan myself and have to deal with the fact that the medications I'm on are expensive. So take it with a grain of salt. Hopefully you can get, even maybe you'll get only one nugget of information that's new. Share it with friends. I think that we all need to learn more about how those plans are working, how to choose plans. So there's a couple of things that I want to add to the previous discussion I've had several months ago about this. Is number one, that there is something called health share plans. They are not insurance, but I have to say I'm starting to look into them because many of my patients, now that I'm outside of the insurance system, I mean, I'm not completely outside, I guess, because we still do prior authorization and all this, but there are many patients that come to me because they have an healthcare system, so they can choose whoever they want to see. When they choose to see me, which is wonderful, thank you. And I realized that some of those healthcare plans are actually better than some insurance, that it's not called a premium, but they actually, the equivalent of their premium is cheaper and they actually take care of everything. What I love about it is that, so I'm going to start with them and I'm going to share that you should probably start looking at them. You can put health share plan, you can call them and learn about them. And this is particularly useful if you are not an employee, if you're an employer, or if you are someone that needs to buy their own health insurance or health share plan. So the idea about the health share plan is that everyone puts some money and you decide how much maximum you can pay if you have any sort of healthcare issue. So for example, for someone like me who had breast cancer, I didn't know that I would have breast cancer, right? And so basically, it will be like, I'm healthy. I don't expect anything to happen to me. I'm going to say that the maximum that I want to be able to pay is 1,000 or 2,000 or 3,000 or 5,000. I think the max is 5,000. It's the equivalent of maximum out of pocket you would. So that's kind of the equivalent of that. And then basically, then you pay a premium. It's not a premium, but you basically fund this amount of money. You fund this group of money. And it's basically more of a community base. It's like everyone is putting some money every month. And if you have an issue, you say, you have signed this at first, my maximum that I'm willing to pay is that much, okay? What's really cool is that it's way cheaper than the current insurance plan, way cheaper. When then you go to different doctors, you go there, you pay as if you are self-pay, so you have to discuss the price. So you say, hey, I'm self-pay, decrease the price. They decrease the price, usually by sometimes 150%, sometimes 400%. The bill, you decrease the bill. And then you submit that amount to your health share plan. The really cool thing, if you're someone that likes credit card points, you get a ton of credit card points if you pay with your own credit card. So that's something to consider. So something to consider, something to look at. I'm just sharing this because that is not something that I knew before, but I think that are actually really, really cool if you do not have health issues that you already know. If you already know of health issues, so for me, for example, I know that I have a history of breast cancer. There is a maximum that they are going to ask me to pay because they are saying, because they are not health insurance, they can actually say that there is pre-existing condition that make your premium a little bit higher. Again, I'm using those words, but I think that they use different words from a legal standpoint. So I'm just sharing this. If you are looking into this and if you have, no issue whatsoever, I think that that's something to look into because it can be really, really cost efficient and it works really well. And I have to say, I'm very impressed with their whole system. Okay, so that's really wonderful. And then, like, if you think about it, if you have a biologic and suddenly, like, there's no insurance or self-pay, some of those biologic places like Humira, AbbVie, and so on, they actually offer it for you for free if you are in certain amount of income bracket. Something to consider. I'm not saying that that's what you need to do, but I'm saying do consider that if you are someone that's self-employed, or if you do not have insurance right away. Okay, so now in terms of the other health insurance plan, how do we look? If you have a chronic condition, if one in the family has a chronic condition, I'm going to say always assume that you reach the max out of pocket. So then we're going to look at how you choose the different plan. Look at the max out of pocket. What's the max out of pocket that you are allowed, like that they will make you pay? All right. So then you calculate, you do a table where you're saying max out of pocket and then premium for the whole year, right? So then you put the max out of pocket and then you do the premium for the whole year and you calculate how much that is max. The max that you will pay will be that. It will be the max out of pocket plus the premium monthly. And what you're going to notice is that then when you're calculating the difference, there is usually a difference where the max out of pocket is actually cheaper than the other ones. Because what's happening is that with the other ones, you're banking on the fact that you may not need to reach the max out of pocket. The problem is that you may. And if you do, then what looks like? What does it look like? So once you've chosen, so if you say, okay, well, I'm someone that has rheumatoid arthritis, I'm usually on a biologic agent, then you're going to reach the max out of pocket. What's really, really cool, and this is where it's interesting, is that I'm going to share with you something that you can do in Colorado, which is you can ask AbbVie, so that in this case, I'm just using one of the biologic agents, but you can use any other biologic agent, right? So very often, they help you pay the max out of pocket. So what I mean by that is that they have patient assistance programs that are not related to the amount of money that you make. And what they do is that they can give you a copay card. And what that copay card does, if you start with first of the year, the first thing that you do is buy the medication that's like a biologic agent. What you do then is that you're using that and you're basically saying to the company, well, help me pay for my biologic agent because you haven't reached the max amount of pocket. You're supposed to pay the whole thing, right? And they help you pay that whole thing. And so suddenly you have this whole max out of pocket that has been basically reached, but basically this biologic agent company has helped you pay for the max out of pocket. I hope this makes sense. This is not something that's doable in every single state. This is not necessarily something that's allowed in every insurance. And this is not something that's necessarily available with each medication. I know that it's possible in Humira with many insurances in Colorado. I don't think that this can go in the max out of pocket, towards the max out of pocket in other states, but in Colorado it is. So I think that that's something that you want to look at, you want to call. So if you currently have an insurance, and have you been able to do that? Things like that, right? And it's something that you want to talk to. You want to talk with the insurance and you want to ask them if it's possible. Make sure that you take the name of the person as talked to you. Make sure that you write down everything. Make sure that maybe you have an email that you can send that back to them. And then contact the pharmaceutical places, like the drug companies assistance program of whatever you have. Are you on Humira? Are you on Rinvoq? Are you on Tremfya? Are you on Cimzia? Are you on Rituxan? Are you on a biologic? Even biosimilar. Even biosimilars, they have patient assistance program. Okay. And if you ask me, oh, but why would they do that? Well, the reason they would do that is that if you don't have the money to make the max out of pocket, they realize that, and they realize that after you've reached the max out of pocket, it's not money coming from you. It's actually money coming from the insurance company. And so they are willing to do that because they know that then the insurance company will actually pay for it. So they're helping you so that the insurance company pays them. I bet they figure out their whole pricing based on that. So don't you worry, you're not I don't believe in big pharma. I actually think pharmas are helping a lot because they help with medications. They do a lot of studies that are very helpful and very needed. So I'm all for them. I do think that from a money standpoint, they do what makes sense for them. So don't you worry about them. They'll make the money. Use them because they are here to help you. They are here to help you. Okay. And the last piece of information is the HSA versus FSA. If you have an FSA, you have to use the full amount of money in that year. If you have an HSA, what's really cool is that you can use the money, you can keep it later on. If you have a high deductible plan, so that's usually the ones that have a higher max out of pocket. They have a lower premium. If you have that, usually the HSA, you can put all of the things that, you can use an HSA. And what's really cool, I like the HSA because it's the FSA also, it's 30% less because it's taken pre-tax. So that's another way to save money. So between an HSA and the Patient's Assistance Program, you can actually save a lot of money. Okay, so that's something to consider when you're choosing your plan. Maybe when you're looking at not the high deductible plan, you're like, well, look, the premiums are so much cheaper, but actually look at the deductible, look at the max out of pocket. And you will realize that maybe it's not as great. And just compare what's comparable. And I think that the deductible, to me, have never really made sense because I always reach my max out of pocket, and the vast majority of people will reach their max out of pocket if they are over 40. Right. And if you don't, that's great. That's great. And if you have an HSA and you have money in the HSA, that's great. And then there's 30% less because it's pre-tax is actually really helpful, I think. Okay, hopefully this was helpful. If you're looking for a rheumatologist in the Denver area, I currently accept patients. I'm a rheumatologist. I'm double certified in rheumatology and internal medicine. I've done 2 rheumatology training. I offer time and availability to my patients. And I really hope that if you're considering a rheumatologist, you will consider me. I would love to help you reach remission and to help you reach understanding of what's going on as well. Until next week, I will see you. Bye-bye. Thank you.